We have now a conversation with Dr. Vandana Agarwal, who joined us earlier today from California. The state is now one of the new hotspots of COVID-19 cases, with the state reporting its highest second single-day increase in cases and deaths today, with more than 11,000 new COVID-19 cases, with many hospitalizations and intensive care unit admissions in California reaching its capacity. California in total has more than 347,000 cases, resulting in more than 7,000 deaths. Yesterday, Governor Newsom ordered all counties to close indoor services in many locations such as restaurants, movie theaters, bars, and many others. While this is happening, cities Los Angeles and San Diego have announced that their schools next month will be conducted by online instruction only. Bringing much perspective on this, Dr. Vandana Agarwal addressed the importance of social distancing, wearing a mask, and washing hands. She also discussed much on the ongoing vaccine trials for COVID-19. Here is the conversation. We're looking at 3.4 million cases in the United States of America with 136,000 deaths. So my question to you has to be this. Did these states across the country reopen too fast? And the spike that we see in this case number, is that a direct result of these reopenings?
I don't believe so. The reason it cannot be just attributed to reopening of states too early, it is because they're doing more testing right now. So that has contributed to the increasing numbers.
Oh, gotcha. And in terms of looking at these other states now, do you think they should shut down in order to perhaps contain the spread of the virus? How should they be handling this right now?
Handling is very tricky. First of all, the most important is social distancing. Just like in Sweden, every citizen of Sweden is disciplined. So we have to maintain social distancing. And obviously, if one is sick with cough, flu, headache, fever, one should not go out and should have the decency of self-quarantining. But proper hand washing, not rubbing the eyes or the nose is important too. And wearing mask is necessary, but I don't know if it is really protecting.
Interesting. That's a very interesting opinion on that. Let's talk a little bit more about California, since it's one of the states that's showing a huge spike of cases, and you're joining us from California. Talk to us about the conditions of hospitals and clinics in the state right now. What is the condition of PPE supplies, ventilators, hospital capacity, ICU beds? Is there enough material for a spike in cases if it keeps on increasing?
Yeah, majority of the spike in cases are not as virulent and requiring hospitalization as the early on cases. And in my neighborhood, all hospitals have designated beds for COVID in ICU as well as otherwise. All the county societies, Los Angeles County Medical Association, Riverside County Medical Association, San Bernardino County Medical Associations are all donating PPE to doctors and their offices. Our clinics are not flooded with COVID at all.
Oh, wow.
Yeah.
So when we keep on hearing about these spike numbers and these increasing numbers, you're saying that you're not seeing them as much in your clinics?
Oh, not really. Not really. Even patients are not complaining. And testing is very simple. Go to the lab with a doctor's order and they will do it.
And let's talk about testing a little bit here. There's two kinds of testing, one for to determine if you have COVID-19 or not, and another one is for the antibody testing. Could you tell us about what is happening in California in terms of these testing, and do you think there's enough testing available right now?
I believe there is enough testing because there are not only some sponsored by CDC and local county societies where they are doing it in parking lots and elsewhere, but the labs also. There are several labs who are doing it. One is the testing for the virus itself, and the second is for the antibody. And I haven't seen anybody being turned off or like turned away from getting these tests. Originally, yes, they were only doing it for symptomatic patients or if you were exposed, but not anymore.
Do you recommend us to all get antibody testing? And I'd like to get your opinion on antibody testing as well. How efficient do you think it's going to be in the long term?
Antibody testing is, what I understand, tests if you have been exposed to the virus and if you're immune to it. 40 to 60% of them who have been, there is a 40 to 60% chance that this may be false negative. That means if you were exposed and had the virus, you may still be negative. And even if you're today positive, you may become negative the next week or the following week, as was illustrated in the study published in Lancet.
Interesting. And from there, I'll have to ask you about treatments and drug trials and the vaccination. There is so much in news about what is happening in all those terms. We have heard various medications throughout this entire process that doctors are testing. What could you give us, on that? And how important do you think it is for us to get this vaccine by the end of this year or next year?
Okay. Vaccine, you has to go through animal trials, phase 1 to see if it is safe. Then you go to phase 2 to see what could be the standard dose or the effective dose, and then you go to phase 3, and it requires time. Right now Moderna has come out with only phase 1 trial. To come out with an approved vaccine is going to take at least 18 months, in my opinion. If they do it sooner, I don't know whether that is realistic.